what he had planned.
Okay. You recording, Jay?
Yes, I am.
Okay. Well, it's 25 minutes after the start, but basically, I've been having pain since I got struck.
Yes, I understand that.
I've been examined.
I'm sorry to hear
Okay.
about it. We're all on your
Well,
side.
I don't know if that's the case.
What kind of a problem did he say you had?
He said that the neurography examination is radiographic evidence of brachial plexus injuries. And
Okay.
he says it's right there in the report from Dr.
Well, we're
Phillips.
not arguing that. We're not here to contest anything. I just want to know what he said.
He said something about, he said you need to decompress the nerves, and that something about scar tissue and whatever he does. He says I do 3 of these a month.
Well, what are they?
Brachial plexus surgeries. He said that's what's causing your pain, and he said that I'm confident that I can help you.
Yeah.
So
Here's the deal.
I'm not a surgeon.
Here's the deal on the whole thing. You are here to see Dr. Davis for a second opinion for the people who are going to be paying for this surgery. They just want to know if it's medically necessary, and Dr. Davis just wants to. What we're trying to say is he doesn't have a specific as to what surgery he's requesting.
That's right.
What
Exactly.
surgery?
Because there's many different surgeries.
Exactly.
I mean,
So I'm going to call and find out so that we can okay this for you.
Who is the expert in this field, in your opinion?
Oh, there are many.
Name a surgeon, the top guy on the East Coast.
Well, there's no.
Do you know
There is
any
no top
brachial-
guy.
Anyone?
Well, that's again, in all due respect, that's not really the issue at this
We
point.
just want to know the
We
specific
want to know
surgery.
what this man is proposing to do.
so that you get the right surgery.
I've seen. He's a peripheral nerve surgeon, plastic surgeon.
Well, to answer your question a little bit.
I'm going to give them a call.
Yeah, to answer your question a little bit.
Excuse me.
I want to make this point while you're still here.
Okay.
Dave, is the thing that, first of all, anybody in my situation here would question or want to know is this man is a plastic surgeon. He's not a neurosurgeon.
He's a brachial plexus specialist.
Well, but a brachial plexus specialist would be someone in the neuroscience field. Normally, that's in my experience. I'm a neurosurgeon.
Yes.
In my experience, people that deal with brachial plexus injuries and work with peripheral nerves are neuro-trained, are not plastic surgeons.
My back surgeon, Dr. Seth Zidman, is a neurosurgeon.
Correct.
He said he cannot help me. He said, I go, why not? He goes, this is not my area of expertise.
Well, that means that's a subspecialty of brachial plexus
He
surgery.
says, he's a neurosurgeon. He says, I can't help you. He
Yeah.
goes, you need to see someone who does brachial plexus surgeries.
Okay, but I never heard of a plastic surgeon being a specialist in brachial plexus surgery.
Have you ever heard of
that.
Dr. A. Lee Dellon of the Dellon Institute?
No.
No? Okay. Well,
What's he? Who's he?
He's at Johns Hopkins, and he's a specialist in brachial plexus. He's written several.
What is he? What training has he had?
He's a plastic surgeon, peripheral nerve surgeon. You've never heard of Dr. Dellon, A. Lee Dellon,
Well,
at Johns Hopkins?
well, Johns Hopkins is just an institution.
But you don't. So you've never heard of
I'm
him?
not questioning any of this. All I'm trying to find out is what is this man's background, which is, even that's not the important matter, is what is he proposing to do to you, specifically?
Well,
And in his letter here, normally the surgeon, in informed consent to the patient and to those who are following as far as evaluating, he is specific in what he's proposing to do from a technical standpoint. He doesn't say anything at all specifically as far. He just says surgery. That doesn't mean anything to me or anyone else. What is he planning to do? And you don't know either, it's apparent.
All I know is he said that, based on the radiographic neurologic
I know
report,
that, the radiographic study here.
something, I don't want to see a video of the surgery. I just know that he said that something about decompressing.
No, but Peter, you want to know what's being done to you. It's your body, and it's your life
Yeah,
on
but-
the line here.
The letter he submitted
Doesn't say anything.
doesn't.
I have it
say
right here in
anything.
front of me. Surgery, I believe, would be significantly beneficial to this patient.
Well,
What does that mean?
I guess if that's the question, is can you get a response from him? Can you ask
Well,
him?
I can't do it today, but for this exam. But I have some ideas, some guess as to what he possibly is considering. But that's the best I can do with this letter, is to kind of guess as to what he's proposing, because I'm trained and this is my area of expertise is neurosurgery. But all I'm doing.
So you've done brachial plexus surgery.
Actually, I don't do that. I would send it to another neurosurgeon who has made a specialty of it. But I wouldn't send it to a plastic surgeon. I would send it to a neurosurgeon. And that's what I'm telling you what I would have done in the past.
Okay.
But it's a rare surgery anyway. It's not done very often. It's very seldom performed. And when it is done, it's done by a neurosurgeon.
That's why this guy performs 3 a month.
That sounds like an unusual number. But,
I said, because I wanted someone who performs it a lot, and
Okay, well,
Anyway.
I'm not going to challenge you any further, Peter. Obviously, you don't know what he's going to do, except that it's just something to do with your nerves. That's all. And that's all right. I'm not criticizing you at all in that regard. But there hasn't been, I will say this for the record, there has not been, in my opinion so far, a detailed informed consent procedure that's been carried out between you and the surgeon. That's all I can say.
Well, I've already seen him twice.
Mm-hmm.
And, when he gave a little injected, whatever it was, painkiller, Marcaine, the pain went away temporarily.
Mm-hmm.
He said that. He says, yeah, he goes, that is where that's where the nerves are. He said something about the triangle, and and he says that correlates to the report, so that makes sense.
All right, now you've seen, let me go down one line here. You've seen a number of neurosurgeons already, correct?
Yes, and as I said,
Dr. Shukri,
Dr. Zeidman,
right?
who said that
Daniel Carr. You see William Stewart. And you were you saw Dr. Singani, right? You remember him?
not really.
Did the psychological testing on you. It's just part of the overall profile. Dr. Moreau, Dr. Conger.
I remember.
His name's familiar.
Dr. Gerwin, Robert Gerwin, worked with Janet Trebell. I don't know if you've ever heard of those people.
No.
Well, I saw him, and he just, he tried everything. He tried massage therapy, cold laser therapy, dry needling. He said the muscles are extremely tight. His physical therapist Jan Dobermans, went as deep as he could, and he just said at the end of it,
You had interlaminar nerve block. You had nerve blocks, did you?
I've had several epidurals. None of them really did anything.
Okay.
And I just know that the whatever Dr. Elkwood did when he put the injection of marking took away the pain on the left side.
Where did he inject you?
I couldn't see it, but my brother who was there said he put the needle in, and I don't know how deep he went, but my brother goes, "Jesus, did you feel that?" I said, "No," and he goes, "Well, the doctor must have really good technique because he went in pretty deep." But he got to a certain point where I almost felt.
That's it?
They're getting with the insurance carrier right now as we speak and trying to get a specific surgery requested.
Exactly. I mean, I think that has to be done anyway,
Absolutely.
whether we carry out this exam or not.
Carry it out, and once we know specifically, we can answer the
I mean,
question.
no one can really opine on this gentleman until we know what he's going to do.
Exactly. Yep. So, as soon as I know, you know, Doc.
I mean, right off the bat, the vagueness is disturbing.
Right, I agree.
It should be disturbing to you as well.
As soon as I know,
Okay.
they're in the process right now.
Well, we'll go ahead with his history and so on and see what we can do. We're here to look out for you, Peter. This is not an inquisition. I'm here to help you, but I'm also here to safeguard you. I don't want anything to occur that isn't appropriate, which I think you can understand. Okay, Peter, how did you hurt yourself on May 9 of 2011? Just in, I don't want you to tire yourself, just general, what did you do?
It was May 9th, 2011.
Right.
It was a pepper spray self-defense training, and basically the instructor, Glenn Stone, he struck me very hard on the left-hand side here with my hands up in the air. So he said...
Where did he strike you?
He struck me here.
On this left side of
From
the neck.
left to right.
Okay.
So, or right to left. He struck me here, karate chop. Hard.
Why did he do that? What was the reason?
She was trying to demonstrate a self-defense technique, and
I see.
and my partner, Angela Myers, was there, and she said, "Are you all right?" Because it hurt. And I said, "I think so." But he said, "Put your hands up and pretend to choke me." So, I didn't choke him. I just had my hands up like this. The next thing I know is he does some move where my hands are up in the air, and then he hit me hard.
Okay.
So that's what happened. And then I went back to work. My neck didn't feel right, but I said, it's hopefully it'll get better as the week goes on. Every day, it felt like, I remember I couldn't turn my neck. It felt like everything had just tightened up, and there was this burning pain in the center of my neck. Very, very, and it just got worse and worse.
Okay.
That's what happened.
In the back of the neck.
In the back of the neck, but then right here, it spread, both sides, and doctors that have felt right here and here, they palpitate and they feel right here and they feel right here, and they say you have tight fibrous bands. So one doctor postulated it might be myofascial pain syndrome.
Yeah.
So that's why I went down and saw Dr. Robert Gerwin. He's a soft tissue expert. He did everything in the book. He did, massage for 3 weeks. I was in Bethesda, Maryland, and he treated me. And he's the expert.
Dr. Gerwin.
Yes. He's
Gerwin.
Gerwin. Robert Gerwin.
In Baltimore?
Bethesda.
Bethesda. Okay.
Yeah, I spent a lot of money, and after 3 weeks of intense training every day, he.
How long? 3 weeks with him?
Yep, and he just said.
What did he say?
He said, I don't think it's myofascial pain. He goes.
What did he say it was?
He says, I don't know. He goes, but he goes, you should, see a peripheral nerve surgeon.
Okay.
And I did.
Who was that?
I saw Dr. Dellon.
Dallin, D-O-W-A-N?
Dellon.
D-E-L-L-O-N. Dellin?
Dellon, yes.
D-O-W.
Dellon.
That's Dellin, yeah, okay.
Dr. A is an apple, Lee Dellon.
Where is he?
He's in Baltimore, Maryland.
John Hopkins.
Yes.
What did he say?
He said it's brachial plexus. He says he goes, I know Dr. Filler in California. He's very good. Your scans show significant abnormalities in your scaling triangles, and both left and right. And he said something about, he said you need to fix that. And
What did he mean by that?
surgery.
The nerves were cut in half, or?
No, he says I don't know. They need to be
Decompressed.
decompressed. I think that's the word. Remove some muscle that's vestigial or not necessarily. You don't need it in. I don't know, something about decompressing the nerves both sides.
Yeah, I think I know what he's trying to say.
But
anyway, I don't have his record.
neurolysis or whatever.
Okay.
But but he's a plastic surgeon, peripheral nerve surgeon. And then I saw Dr. Elkwood because he's supposedly.
How did you get to him?
I went online and I googled
You Google him.
people
Okay. Oh, that's all
that
right.
had had this surgery and that have had successful surgery. So I got some, basically just like people who've gone on to have this surgery and the doctors that they have recommended.
Mhm.
Dr. Elkwood was highly recommended as someone who has a specialty in this area.
He's in Shrewsbury, New Jersey? Is that
Yes.
correct?
So,
So you went there and...
all you gotta do is go on his website and or just Google. This is what he does. He does a lot of this surgery, and he examined me, and he's like, he wrote that maybe that's not detailed enough. He can provide something more detailed of what he's going to do. But anyway, after meeting with him, he was the second surgeon that said this is what's causing your pain. So, at that point, I said, well, I need help. I don't want to live in constant pain. I don't sleep anymore. I'm taking an enormous amount of pain medication, and it is barely holding the pain back. And it's a struggle to take a shower anymore, much less, I haven't driven a car since September of 2012, and it just constantly feels like a rubber band that's being stretched, and it hurts, and it's very painful, both sides. And he palpitated on right and left, and he said you're gonna have to have surgery on both sides. And I just said, well, I was hit on the left. Let's do the left first, because if God forbid it, I don't want to be worse, but I am right-handed. But if it works on the left, then I would feel more confident, going to the right. But I'm scared to death. I'll be honest with you. I wish there was a non-surgical solution. But I tried physical therapy, chiropractic, massage therapy, dry needling, cold laser therapy, acupuncture, hot water jets, heat, cold, injections, trigger point, epidurals. There's only one other thing that this Dr. Gerwin said. He said it postulated. He goes, I doubt it. He goes, that may be a 10% chance, but he said it might be. The guy that hit you, he fractured the spinous process of your C3 because that was fractured, and it shows some edema there. he said, it's possible that might be causing your pain all the way down, but he said, the only way to rule that out is with a selective C3 nerve block.
Did you do it?
I'm supposed to have that. I'm waiting for it. I got approval. I'm just waiting for them to schedule it. But if that doesn't work, then he says there's no doubt in my mind that, you know, Dr. Dallin recommends surgery, Dr. Elkwood recommends surgery. You're either gonna stay the way you are and get worse, because Dr. Dallin did some tests down there where he had a machine that John Hopkins, he said, you realize you're losing strength in your hands? And I said, I don't think so. And he goes, you don't feel it yet, but you have. And his machine, he says, you have lost strength. And he says, you're going to continue to lose strength as time goes on. He goes, it's subtle, but it's there. And he made me raise my hands up in the air and squeeze them in a fist for a while. And at a certain point, I couldn't do it, and that brought on my pain. And he just said, have surgery. And, I admit Dr. Dallin is, that's why I went to Dr. Elkwood for a second opinion. And he said, yeah, I believe this is necessary. So, granted, that paragraph may not be enough, but if you need to give him a call, find out the surgery he's going to do, whatever you got to do. So, but I think going on 2.5, 3 years is, this is not going to heal. If it would have healed by now, if it would have healed, and I've tried every thing that I know of that's not surgical, and so I don't want to be worse, but I don't want to stay like this. And if I'm going to go down, I want to go down swinging. I got to give myself a chance. So I believe that this guy is the best surgeon. That's why I decided to go with him. And that's just from my gut feeling. And I believe his surgical skill is at his, what's the word? He's in his prime. The reason I went to this guy too is, in addition to being, supposedly a renowned expert, is I do have family in the area. So,
where would you be operated on if he was going to do this? In New Jersey?
The Jersey Shore Medical Center.
Where's that?
It's in I think it's in Neptune, New Jersey, maybe?
Neptune, it's up there. Okay. Northern
It's
New-
close. His office is in Shrewsbury, and
That's up in the Barrier Islands north. That's where Neptune is.
my cousins live
I know.
in Seagirt, so they have a spare bedroom and my own bathroom. So I mean, the good news is, like, if I have the surgery there, I don't have to stay in a hotel. I don't have to fly. My family go down there with me. And, one night in the hospital, he said, and then, if I need to stay at my cousin's, I can stay there for, a while to recover. And ultimately,
Okay.
He's supposed to be,
No, I
the
understand.
expert,
I understand.
and all the brachial plexus surgeons that I've seen have all been peripheral nerve surgeons, not neurosurgeons.
Okay, all
you
right.
know.
Well, that's all right, Peter. We're not here to argue about that. The symptoms now that we're trying to correct are basically posterior neck pain. Is that correct? Back of your neck?
Here. Here.
Okay. How are your arms and hands doing?
There's tingling and numbness in the pinky and the thumb.
How about your arms?
My
Your
arms
arms are okay?
seem okay.
Okay.
It's my hands. This is where I feel the tingling.
Which part of your hands is mostly affected?
Thumb, pinky, and this
Okay,
finger.
all the fingers apparently, correct?
Mostly the pinky and this finger.
All right.
And
Well, that covers the whole hand. I mean,
Oh,
it's
yeah, but-
both sides. Okay. All right. Basically, your back of your neck radiating down over your trapezius muscles, these muscles in here, and tingling in your hands. That would cover it?
yes,
Okay. How about the front of your neck? You're all right here? It's just the back and the sides, huh?
right. I mean, it's this here. I mean, and actually down my shoulder blade. It's almost like when people push on it, it's crunchy. I mean, it's like I mean, something's not right, and
Okay.
I can't. I don't know. I just, they examine me. They say, oh yeah, this correlates to the neurography. They just say this is C8. There's something in the nerve that runs down here. If it's being blocked here, it can cause the muscles to clump there. All I know is I'm in constant pain, and it's gotten to the point now where, I'm not sleeping even with the medications.
Now, he just injected the left side.
He just put a needle in the left side,
Where was the needle entered? Show me where it
somewhere
entered.
over here.
Back there, in the back.
I
It wasn't the front of the neck. It wasn't up here.
it was on this side. I mean,
Was it a trigger point injection, you think?
No. I mean, my brother was there, and he said, he looked like he went pretty deep.
Just the left side alone?
Yeah, he just did the left side.
And it was back here, it wasn't in the front.
It wasn't in the front.
Wasn't in the
No,
front.
it wasn't here. It wasn't here. It was. You know what? He would know. I mean, he knows exactly where he put it. I mean, so.
Well, he's not here, so. we
But
can't ask
but
him.
I mean, if you need to get the specifics,
Mhm.
I'm sure he could provide that.
Okay.
I mean.
All right, well, then we've covered it pretty well. Past history, Peter, do you have any past medical problems I should know about?
Well, I've had a spinal fusion.
When was that done?
2003 in Rochester with Dr. Seth Zagman. And he took out the L4-5 disc. And I woke up in the hospital bed, and
How'd you do
pain
with
was
that?
gone.
So you did well with that. huh?
I went from complete disability back to work.
Okay, you returned to work with that, okay.
Yeah,
What-
so-
what kind of work do you do? Or did?
Well, I was a social worker, and this the point of this class was supposed to prevent workers from being injured, and this guy that hit me hit other people in the class, and he hit a girl before he hit me, and she screamed, "Don't effing touch me," and
Okay.
so. Obviously, he used excessive force, but whatever. The way he hit me in my arms, whatever he did.
Now, this study that you had, the neurography,
Yes.
they're saying here that your symptoms were just on the right side. So did they become bilateral later, or was that a mistake?
I've had pain on left and right, and as far as the neurography shows abnormalities on right and left.
Findings. These images demonstrate the course and caliber of the right brachial plexus, contributory cervical and thoracic spinal nerves, and descending shoulder and arm nerves. So apparently the study was just on the right side.
No, it was
That's
done
what
on
it
the
says.
left. Well, you don't have the full report.
That's the full report. Here's your report. That doesn't mean that they didn't do it, but that doesn't reflect it there.
This is just, I had MRI neurography of the left brachial plexus done. So this is right.
So I don't have that one.
You don't have the left.
Okay.
And there's also a cervical. So you're missing two.
Well, I think I have the cervical, but I know about the C3-4 thing. But I don't have the
Well,
left side.
the left side, I don't have it with me, but that was done, and you know, I don't know why you don't have that.
I don't either.
Well, the left side was done, and that Dr. Elkwood has it.
Okay.
Dr. Filler has it. I'm sure the Neurography Institute has all the copies.
Okay.
So you don't have the left brachial plexus, so you don't have it. Okay.
I'm just reviewing something here, just for a second here. We're almost done the interview anyway, so we're moving along here.
Who are some neurosurgeons that perform the surgery?
Not very many around here.
Yeah.
The famous one is a guy in Louisiana, I forget his name, at Tulane.
Is he good? Is he good?
World renowned, yeah.
And where is he in? Louisiana?
Tulane,
Tulane, Louisiana. What's his name again, Doctor?
can't remember.
Okay.
That's where
He's rolling around.
Oh, I don't have everything in my command, you know. But I do remember that. That when you had trouble, you sent them down there. What hospital affiliation does this gentleman have? Just the one in Neptune there?
I think it's called Jersey Shore Medical Center.
Okay. You've not worked since your injury yet, Peter? Is that correct? You've been out of work since?
I've been out of work since the injury, and you know, for the longest time, every doctor was telling me that you know, there's nothing wrong.
No, we're not saying.
And you know, it wasn't until I started, you know, paying for, you know, exams. I paid $7,500 for that neurography scan, you know, out of my own money, you know. So, you know, I spent a considerable amount of money, not to mention going to Bethesda and Baltimore and everywhere else trying to figure out what to do. And I finally gotten to the point where you know, it's not healing, and I don't want to live like this. And it, you know, it just, you know, I know something's wrong, and you know, I was hoping for a non-surgical solution.
Did anybody suggest to you looking at your circulation in the same area? Because
Circulation?
this condition,
No one's
You
ever mentioned
Never mentioned
circulation.
anything.
What is circulation?
Your brachial artery, subclavian and brachial arteries, because they're in the same area that we're talking about, and they're very often associated. In other words, there'll be some sort of compromise in your circulation. It's just, I'm just throwing out that question. Nobody mentioned anything.
Is there a test that,
Yeah, an arteriogram.
no one's brought that up?
Nobody brought that up, okay. Well, okay, I'm not pretending to be the world expert on brachial plexus surgery, but I certainly can at least try to help give some options here for you.
Well, I mean, if this guy in Tulane is I don't know who you're referring to.
Yeah, I'm not sure of his name. I don't even know whether he's practicing anymore or not.
Well, I mean, is he in his prime or?
No, he wouldn't be in his prime now. He was in his prime.
You know, I need someone who does this surgery on a routine basis. I
yeah.
don't want someone that does one every month.
Well, yes, but that doesn't ensure quality, does it?
No.
Somebody could be doing the same thing over and over, but doing it wrong. That's possible, you know.
Yeah.
So that's not the issue.
But-
The issue is, what are we doing for you? Are we addressing your difficulty? Okay, past history, Peter. Do you have any medical issues?
Well, I told you I had spinal
Spinal
fusion,
surgery, yes.
And,
Anything else?
Yes. Had a umbilical hernia, May 26, 2011. My belly button popped out, and it hurt, and I was throwing up bile, and so I went to the hospital, and they said you need emergency surgery, and
Okay.
they
Sounds like you did all right with that.
they cut out part of my intestines and sewed it back together.
Anything else?
Well, depression now because
Well, I'm not here to get into that with you.
I mean,
That's- I would be surprised if you weren't.
I mean,
Of course.
constipation from all the medications, and then I take, the MTs and the other medications that counter the drugs, but now I'm reached the point where the medications are no longer providing relief, so, do they increase my pain meds, or do they switch me to a different pain med because I'm, that...
I understand. Any other procedures? Any other operative procedures?
Yes, tried, it's called, had a cervical rhizotomy because I thought maybe it might be the facets causing the pain.
Oh, I see. You had a facet
Where they went in and they,
rhizotomy.
and they said, well, if it...
Did you have the injection first to see if it would be helpful?
Yes, they did
Who did that? The pain manager guy?
No, Dr. Lou.
What is Dr. Lou?
He's orthopedic spine.
And he
surgeon.
performed it?
And he performed it, and it didn't do anything. It didn't release it. So he said, well, it's not the facets.
Okay. When was that done? Remember?
December 13th, 2012.
Almost about a year ago, huh?
Yep.
Okay.
And
All right.
it feels like frostbite, burning pain.
Be like that family that were found, remember? Did you hear about that in the news? They were lost in the mountains. The father burned a spare tire to keep warm.
Oh yes,
They
it's
found
on the news.
4 kids and adults.
But
Well, you've had your problems, Peter, and I'm certainly sorry.
I've had,
I have had some, not similar exactly to you, but I have spinal difficulties and all that. It's made me quite compassionate to you folks
Oh.
who have spinal.
I've had kidney stones, you know, my
understand
back
your
surgery,
pain.
but this is the worst pain of anything that I've had up to now.
That's the pain involving these areas.
Yes, and it's here, it's, you know, and I don't know. I mean, at first I thought it had to be a disc. It had to be a disc, but then I'm being told, nope, you know.
Well, that wouldn't explain it then.
So, you know, time went by, and, you know, it wasn't until I paid for that neurography, which you don't even have the left one, which you're either gonna have to.
You did this in Santa Monica, California?
I had it done in Buffalo, and the doctor.
Oh, that's another branch of this place.
The doctor that reads it is Dr. Aaron Filler. He's world renowned, and he, you know, reads the images.
What do they do? What do they do? Inject something, dye in your?
No, they just.
What do they use?
What do you mean?
Is it an MRI or?
It's
CT?
an MRI.
It's an MRI.
And they did the left, they did the right, they did the cervical.
When did they do the left one? 'Cause that
They did them all the same day. So whatever.
strange that I don't have that.
Well, that is strange. But
February 13,
Yep.
2013.
yeah, I don't know why you don't have it.
West Seneca, New York.
Correct. That's outside of Buffalo.
Oh yes, it's MRI scanner.
And so that's when, you know, after those results, that's when, you know, I asked, you know, Dr. Zeidman, I said, can you help me? And he said, I'm a neurosurgeon. He goes, I can't help you. You need to see a peripheral nerve surgeon. So that's what I did, and I was praying for a non-surgical solution. I even tried, that's why I went down to Bethesda for 3 weeks, because of this guy who says, you know, people that have frozen shoulder and all sorts of myofascial pain syndromes, he says, and he tried the dry needling, the massage, everything, and after 3 weeks, he just said, you know, I don't want to keep taking your money. He goes, you know, I'm not seeing an improvement, and he goes, I think you got something else going on, and he even said, he goes, if Dr. Dellin says this is what you need, he goes, I would trust him.
No, we've covered that pretty well.
So I mean, you know, this, you know, I want to get better, you know, and I'm at a point now where if it's praying hasn't worked. Resting doesn't seem to be helping. Every therapy I've tried hasn't resulted in improvement, significant improvement. So surgery is the last course of action, and I think I'm at that point. I don't know what else. You know, you mentioned some arteriogram or whatever. I'm not even sure what that is, but if they want to do that here or wherever, you know, have it done. But you know, I mean, you don't even have the left brachial plexus results, but that was done. They did the left, right, and cervical. So I mean, they all indicate problems. So anyway, and that seems to correlate with my pain. Unfortunately, I don't see what other course of action I have other than to try and you know, give myself a chance at getting better. You know, it's going on 2.5 years.
Okay. I guess we finished that. Are you allergic to anything, Peter?
The only thing, oral morphine, not liquid, but oral. I gave me some oral morphine pills, and I vomited after taking them. But I've had morphine in the hospital, and I pushed a button. I've never had a problem. So, no, that's pretty much it. I don't think I have any other allergies. So you've never heard of Dr. Dallin or Dr. Elkwood?
That doesn't mean anything. That doesn't reflect on them in any way. Okay, I want you to sit on the edge of that table, and we'll do a little bit of an exam. I don't want to hurt you from causing any exacerbation of your symptoms, but we need to see a little bit about your neurological. You're not running out of your battery there, are you?
I am good right now.
Well, good. What kind of camera is that?
There's a Canon.
Canon, they're good.
Yeah.
Good camera. I have a Sony Handycam, which is an old one, but it works. Okay, let your legs just hang loose then, off the stool. Take the stool away just temporarily here. Okay? All right. Yeah, are you all right there?
Yeah.
Good. This sharp here,
Yes.
sharp here,
Yes.
sharp here.
Yes.
You'll be poking you there, all right? Here?
Yes.
All right, good. Down in here.
Yeah.
Okay. Down in this area, here.
Yeah.
Okay, very good. Here
Yeah.
and here.
Yeah.
Good, your legs are fine. Now let's go over your extremities here a little bit. Just relax there as you are, you're fine. Scratching. Feel it?
I
Feel
feel that.
scratching? Feel scratch.
You feel that?
Here
Yes.
and here.
Yes.
Okay. Yes. It's a nice watch. What kind is that?
It's a what,
It's
a
a,
wave.
it's a super
wave.
watch anyway. All right, just relax here. Hands. Feel me poke here.
Yeah.
Here. Here.
Yes.
How about out here? And here.
Not as strong.
Not quite as strong, but you feel me.
I feel, but it's numb.
And here.
Yeah, it's just not as sharp.
I'll turn your hands over. Let's try it this way. Here.
I feel that. Yep.
Here.
I feel that
Feel that
better.
right? This is less responsive here compared to here. How about comparing this and this?
Feels weaker on
And this
the pinky.
on the inside? Yeah, over here.
Yeah.
Here,
Well,
not as much, huh?
the
Okay,
it's more on the outside.
okay. That bother you at all?
No.
No problem there. Here? You're all right there?
Yeah.
You don't feel any symptoms there? Okay. If I do this? You okay there with that? Okay. Bring your thumb over towards your little finger against me. Good. This one? All right. Spread your fingers. Okay, now hold them apart. Okay. Spread your fingers. Now. Okay. All right, that's good. Squeeze. Squeeze. Mm-hmm. All right. Relax here. Over here. Pull your hand towards your chest. Push out now. Pull in towards your chest. Push out. Okay. All right, I want you to smile on the floor and face the pretty picture of the snow, which we're getting throughout the country. Fortunately, we're not cursed with as much as they are right now. where your pain has been?
Yes.
Right there.
Yes.
Am I hurting you? I don't want to hurt you.
No, well, that,
But
you gotta palpitate.
But that's it.
Push in.
Uh-huh. That's this area in here.
Yes. Can you, it's like, keep pushing, I mean, that's.
That's enough. Turn around. How about in this area? Feeling me?
Yeah, but it's not up there as much. Sort of right where your thumb is, there is where it kind of starts.
Painful in here?
No,
Here?
no. Right there, kind of like there, that's where it starts.
And this area?
Yes. And
Okay, push your head back. Hurt?
a little bit, yes.
Push forward. Okay, turn your head to the left. To the right. Okay. Push your arms out away from you. Okay, pull in. That's tolerated pretty well, huh? You can do that all right?
Believe me, it just feels like
A lot
a
of-
tightness that won't relax.
There's a lot of pain up in there.
And
Okay.
that's where the pain is, it's like burning
Mhm.
pain. And when you push there, now I feel symptoms here in my pinkies.
We're all done.
So,
Been a pleasure, Peter. I'm sorry we had to sort of drag things out here, but you just didn't know all the details so much, but we got there.
I hope
Appreciate your coming.
if you need more details, you will contact
Oh,
Dr. Elkwood.
Don't worry, there'll be a follow-up, I'm sure.
Because,
There'll be a follow-up.
I'm gonna have the surgery. It's just a question of, I want the best doctor.
Mhm.
I mean, if you really think this guy in Tulane is better,
Well, I'm not pushing that. I'm not making any suggestion in that regard. I just mentioned that when you asked me who I knew did this, or was known for doing this, that's the name that comes to my mind, but I'm not even sure that they're
Well-
doing that anymore.
well, how did they do this surgery? I mean, do you know?
Mhm.
You're a neurosurgeon. I mean, do they make a cut here?
Oh, yeah.
Make a cut
Well,
here?
there's various things that they operate on this for, and depends on what they are. In your case, why, it could be a very simple matter, not a big extensive operation at all if they do it.
Well, this test that you mentioned, arteriogram, or?
Well, that's sometimes performed in a workup of patients like you, to confirm that there's compression
Can
of
that
your
be?
structure, neurovascular compression.
Can that be, is that something that should be done?
Well, some people would say so, yes. Or they would say that without demonstration of compromise, why then the diagnosis is not confirmed. But that's just various opinions. It's a complicated thing. There's no one standard that is necessary to be upheld in regards to this area. This is a it's a controversial
Do you
area.
feel something, wrong here? Can you feel it?
Yeah, well, I can feel your response, yes.
I mean,
Your response is clear.
meaning,
Pain.
okay.
Pain on provocation of pain when I palpate the area, sure, of course.
Okay.
That's what it is. All right, cameraman, you're all done. You can shut her off there.
Thank you, Dr.
All right, Cecil B. DeMille's connected this morning. Thank you, Peter, very much for coming. Good luck to you, son. I wish you luck.
I hope that this works.
I do too.
I guess I'll find out.
You will.